Okay, the next one is medical and pharmacy coverage for city retirees. City Manager.
Yes, sir. A meeting was held on 26 May with the city staff and approximately 75 current city retirees regarding the status of the city's health coverage for retirees. Human Resources Director Joe De Niro and Ms. Jan Bush, the consultant from Robinson Bush Incorporated, will present a summary of this meeting and outline potential options for retiree health care coverage for FY17 and beyond.
The floor is yours.
Thank you, Mayor, City Manager, Council members. Good evening. Joe De Niro, Human Resources Director. The purpose of our presentation this evening is to inform you of the retiree meeting that we had and the some of the concerns or expectations that our retirees have of their medical coverage. So we wanted to share that information, bring that back to you. As you know, some of your interests as we move forward in trying to contain the costs of providing and sustaining this benefit for our retirees. So some of our expectations is to ensure that we're meeting some of your expectations as well as we work through the process of renewing our coverages, Medicare in January, coming up in 2017, and then going through our health care coverage through the budget process. So this is an information meeting. No decisions have to be made at this point. We expect that we would go from this meeting, have another meeting with our retirees, get into some very specific expectations that we would have, and then come back to you through the budget process to kind of put this all together. So we want to share some of that information we have now. I'm going to turn it over to Jan to take you through the meeting that we had and some of the processes as we move forward. Okay,
do we have the PowerPoint presentation?
If you have the PowerPoint in your packets, we do have it up on the screen, so members of the audience will be able to share it with us. So.
Technology, great. Thank you, Joe. Good evening. I'm Jan Bush with Robinson Bush, and it's a pleasure to be here tonight. Thank you for having us come and update you on our activities with the retiree group. So this evening we're going to have the same issue here. We're going to reiterate the policy, the current city policy for retirees, and we have 3 categories of that. And then we're going to talk about the meeting that Scott mentioned about the May 26th meeting with the retirees to present information for conversation and feedback. We're going to talk about the 2017 considerations that we did go over with them and brief you on the feedback that we did receive, and then we'll talk about the next steps and where do we go from here. So the retiree subsidy policy at this point revolves around October 1 of 2003. If you were hired before that date and you retired before April 4th of 2014, you have a set of benefits that are 100% of the employee-only health plan premium paid by the city with a maximum benefit not to exceed $500. If you were hired from in that time period and retired after 4/4/2014, you have your subsidy at 50% of the employee-only premium, or $8 per year of service, not to exceed the $500 a month. And then for anybody that was hired after October 1 of 2003 and now retiring, then it's $8 per year of service, not to exceed $200 per month. So that is the policy. The majority of individuals are in that 3rd category that were hired after October 1. So we'll be seeing the impact of those policy changes taking place over the next several years. As was mentioned, we did have a meeting. We had a pretty lively conversation with about 70 to 80 retirees on May the 26th here in the council chambers. The attendance was excellent, and everybody was very involved and engaged in the conversation. We thought it was an excellent attendance. We had both Medicare and non-Medicare retirees in the audience, and they obviously have some different needs from their health care perspectives when Medicare is in play. And then we opened it up for feedback from the retirees, and we did get some feedback that we want to share with you. We addressed the non-Medicare eligibles first. These were not recommendations at all. They were concepts that we wanted to throw out to get the dialogue started and get some feedback from the retirees. So we looked at things like offering a lower cost option as a base plan and having buy-up options, stipends or opt-out plans that might provide an opportunity for people to buy something that might be more suitable to their health care needs. And we did get feedback about the employee health clinic, that is an important benefit that they do value. So continuing to allow access to that employee clinic is important for those non-Medicare eligible retirees. For the Medicare eligibles, we talked about some of the Medicare plans that are available. So we talked about the Medicare supplements, Plan N, with the prescription drug plan as the base plan that meets the statutory requirement under Florida Statute 112.08 that requires the basically the same benefits. And then we talked about some options beyond that. So offering the Medicare Advantage prescription drug plan as an option based on the county RFP that we had done a year ago that the city of Titusville participated in. So there were multiple plan options that we might have available as potential options for the retirees that are on Medicare. We talked about the possibility of a stipend to opt out. So, you know, someone who maybe doesn't have a lot of health care needs but does need to have that protection and they have Medicare may be able to have something that's less expensive, and then maybe have a stipend or some other financial monetary remuneration to make that difference. Another thing that we talked about is the employee health clinic. Once Medicare eligible, once a retiree is Medicare eligible, the clinic is no longer available for use by those individuals. So there was some interest in maybe looking at options or something proposed that might give options to those Medicare eligible retirees to use that employee health clinic. So these again weren't recommendations, they were just concepts, thought-provoking options to just throw out. So we did get some feedback and we've listed a few of the items, and probably the overwhelming message was we really don't want you to take anything away from us. We worked hard and gave our careers to the city, and we value our retiree benefits, so we would not like to have anything taken away from us. But there were some other things that they were open to that we can maybe come back and talk about. One thing that was mentioned is that $500 monthly cap. That was discussed as something that they really feel strongly should be taken away and rescinded by council. They did express some interest in reviewing an opt-out or a stipend, but they needed more details, and we weren't really there with details. It was really more of that first opportunity to talk about what's going on and get that dialogue going. As I mentioned before, the employee health clinic may be an option for consideration. That was a very it seemed to get a lot of high interest. They asked that maybe there'd be a consideration to lowering the $8 a month for future hires, future new hires to the city, that maybe that current subsidy policy could be adjusted so that rather than $8, it was something different than $8 to address that into the future. And then there was some conversation about just the time needed to make these decisions, that it's a complex and a difficult situation, that they felt like they would like more time to study their options, and that any changes would be effective potentially in 2018 for them, so that there would be sufficient time to understand what impact that might have. So that was some of the feedback that we received. Next steps, we're going to be going back to them. We said that we would have another meeting with them. They would like, one piece of feedback that we got is they'd like a little more timing on notice of these meetings, so we would like to give them as much time as possible as we contemplate when that next meeting will be taking place, probably in July. Compiling a list of the retiree options based on the previous slide where we talked about some of those concepts that we could put some detail around and put some structure to put out there and deliberate with the retirees, conduct that second meeting, and then come back to you with a recommendation once those recommendations are solidified. So that is the briefing that we have for you this evening. If you have any questions, we'd be happy to
Does
answer.
council have any questions for Ms. Bush? See none, and we appreciate your being here for this, and we understand that we're still in the concept phase, and everything you've presented and everything we've heard so far is concept at this point and not proposal, and those proposals will work their way through the budget process. So that's when the real work begins. Right now, we're just feeling out what our options are. City Clerk, do we have cards on this item?
We have two.
Okay.
Stan Johnston.
Member Behringer.
Thank you, ma'am. The only question I had was, as I looked through some of the, not just feedback, but some of the ideas that were presented, I know that some of those ideas came from council, and I think that one of the questions that I had thrown out there was in the understanding that, not just in Titusville, but healthcare costs go up right now. Is that just unprompted feedback on solutions for it? So were there any additional, as I'm looking at the feedback, I think, or ideas to engage on how do we do cost containment, right? So were there any that, as the retirees came out and said, you know, that, we see where you're going, but how about 5, 6, 7, and 8? Or is that just the feedback that was listed right there?
I think we pretty much, we had good dialogue, but I think it was revolving around the concepts that we threw out,
Okay.
but it was good dialogue. I thought the retirees were receptive to looking at details around some of the concepts,
Okay.
and not just concepts.
All right.
What are you looking for?
Oh, there it is.
Vice Mayor? Just hold on a second.
If I may, you talk about options. Are you meaning options to present to the retirees as options? Is that what you're talking about? Or are you talking about options for us to look at?
One of the things, and I think this will key off on Councilmember Behringer, Councilmember Johnson, one of the concepts that Jan was talking about is adding to the benefits that we already have is maybe an option of opting out, and the value of that opt-out, what would that be? And we only talked about the concept, we didn't talk about the value of what that opt-out is. And then the question was from the retirees is, okay, if we have that option to opt out, then what are we going to be able to have in exchange for opting out? So we had some good dialogue about they would like to see how that would work itself, and then we went through, we had an RFP we partnered with Brevard County, so we received some information back from them in terms of how their process is in opting out and getting a monetary value for opting out. So these are the things that we wanted to specifically have a conversation with the retirees, and then present these as they become a little bit more clearer to us and them back to you as some considerations for the future.
Let me rephrase my question a little bit. It's their option to take it or not, however. Is that correct?
Yeah, the option piece is in addition to what's already exists. So,
And if they opt not to take it, then they can remain the way it is now?
correct, yes, sir.
Okay, well, that
Yeah.
gives me some comfort.
And let me just
That they'll be
address...
able to make their own choices on it.
That's correct. Yeah. And one of the concerns that we've heard, we've got a number of retirees who, have some illnesses. They're on, medications, for example, and, they're interested in staying where they are in terms of not disrupting what they already have. So an opt-out, or maybe that additional opt-out experience, may not be of some benefit to them. They're very secure about what they already have. So
I understand what you're saying. My point has been that it's the retiree's choice. For some of them, there may be benefits to doing all of those things. For some of them, there may not be. So we're not going to say, you have to take one of these options that isn't the status quo. Thank you.
Any other questions? Okay, Mr. Johnson. Oh, I'm sorry, Member Pritchett, go ahead.
I just wanted to comment, I think the health clinic's very creative. I didn't even think about that, so that might be a good option for everybody. Let me ask you a question on this, because I just started thinking about it. If they choose to do the stipend, are they allowed to unchoose the stipend down the road if it's not working for them and move back in the program? Is that something we're working on for them?
It hasn't been determined. Generally, it's an irrevocable opt-out. Once you leave the plan, then you've left the plan. It would be somewhat risky to have people, I'm healthy this year and I'm not healthy next year, so I'm going to go on this plan and I'll take the opt-out the following year. There are no details around what's been decided at this point.
Okay.
But generally, an opt-out is an opt-out, and it's usually irrevocable, not always.
All right, but something we could maybe discuss, but definitely something everybody's going to understand before they make decisions.
Absolutely. And we did talk about it in the retiree forum on the 26th. We talked about that it would more than likely be an irrevocable election to do that. So, but it'll obviously have more dialogue.
Okay, thank you.
Mr. Johnston?
My name is Stan Johnston. I'm a retiree of the city of Titusville, and I'm on Medicare. And I want to say is that this has been an excellent health benefit program that the city has, and I had it before. Also, before being on Medicare, I had it when I reached 62. I was on it. So I want to express something that was at that meeting. I'm going to have ask Joe and Jan to clarify it, because, or to express the consensus at that meeting, is that this, especially about this $500 monthly cap, which does not affect me but affects others. And it's, there was one person who spoke, and I'll mention his name, is Jim Stevens, and he was talking about something that I didn't quite understand, but that he is going to, after about 30 years working for the city, he's going to have to put in more money towards his health care benefits and also his spouse. So I believe the consensus of the meeting is that there was a promise made that there would not be a cap, and this $500 monthly cap is breaking the promise, and that this was instituted, the $500 monthly cap, when people weren't looking, as if it was done behind their back. And it was somewhat saying is that council shouldn't have done this behind our back or something like that. So this was this is of concern, and it's I know people are in a bind, financial cities in a bind, but we want to try to keep our promises. So I'm going to ask Joe or Jan, maybe they might comment on that. Thank you.
Any comment, Mr. De Niro?
I mean, it goes back to the slide that we were talking about, the eligible groups of employees and the benefits, and depending on when they elected to retire, they knew at the time and what those expectations were in terms of the benefit. And there are some members that are going to be retiring, and should they retire normal retirement, and be eligible for the benefit, they could receive an $8 per year for each year of credited service, depending on what the group plan is, the contribution or the cost of the group plan. There could be some cost sharing that they would have to participate in to continue to be a member of the health plan that ongoing. So there is some cost share with the retiree depending on when they retire. That's absolutely correct.
Okay. Next card, please.
Kathy Mosley.
Good evening, Mayor, Council.
Name for the record, please.
Kathy Mosley. I'm a
Kathy, you might want to pull that microphone down just a little.
I'm a current contract employee with the city. I retired in 2008 after 35 years. I'm still tracking my time. I'm at 43 plus, so this will be my final year. I do want to say that the presentation by Jan and Joe certainly was as a more positive outlook than the meeting that I attended. I have to say that 75 people, about 38% of eligible retirees, attended that meeting. I think you would have had a lot more in there had we received notice that was more timely. I got mine 2 days before the meeting, and that gave us a better clue of exactly what that meeting was going to contain. The meeting notice that I got, it says you're invited to attend a public meeting to discuss retiree health care coverage. City staff, along with our health care consultant, will be on hand to provide a brief overview of our retiree health care program. Somewhat the same every year as we have benefit changes, et cetera, et cetera. Unless I went back and reread this. I said, is there a code here? Should I have assumed something different than this is just the annual, hey, we changed and tweaked this thing? I guess what I should have done was paid more attention to the first line. You're invited to attend a public meeting. That should have keyed us in that, wow, this is not typically what we're going to do. I feel like I was lambasted sitting down there. That I don't think it was very clear to myself. I know there's a lot of people here tonight that was not very clear that this was only, gee, we're throwing out these options. It was pretty much, we're going to be doing one of these. Now you can come aboard or you can't come aboard. There wasn't a whole lot of positive feedback at all, mainly because we had no information. I referred to it as
30 seconds.
I don't want my fingerprints on your bloody knife. You're not going to do that to me. Before I say anything, I want information. You're bringing this forward. You have not given us anything. I have some prepared remarks, but I'm going to wait for your next meeting. And by the way, Councilman Merringer said, staff, please make sure that the retirees know whenever anything is discussed concerning the retiree insurance. We did not get notified of this meeting. Thank you.
Thank you, Ms. President. Well, our intent certainly is to keep all of our retirees informed, and if you did not receive timely notice, then we need to do a better job of that, and I'm sure the city manager will do his utmost to make sure that you are informed well in advance of any meetings do we have to discuss these issues. In terms of retiree health care, you all have to be aware that costs continue to go up, and it's our taxpayers, in many cases you yourselves, because many of you are not only retirees, but you're still citizens of the city of Titusville. So someplace, some way, we have to be able to find some formula by which we can keep you with the best possible benefits we can give you, and at the same time match the costs of ever-rising health care. That's the challenge, and that continues to be the challenge, and we will work it as best we can. One of the things that I have asked for continually is to address the difference between retirees who are pre-Medicare and retirees that are already on Medicare. And I know from retired Medicare recipients that I'm aware of that there are plans out there wherein the retiree is on Medicare and has a Medicare Advantage plan that is no cost whatsoever. And they're still pretty darn good plans. Now, they may not be exactly up to what you all have, but they're probably pretty darn close. And so what I have continually asked staff to do is look for ways to find ways to reduce our post-Medicare retiree costs so that then those savings can be used for those people who are between retirement and Medicare and keep those benefits up also. So those are some of the options that I know I've continually asked people to look at. But it's a balancing act, and you have to understand that we're trying to do the absolute best we can for our retirees and our taxpayers, and it's a delicate balance, and we will continue to do the best we can. But we certainly want your suggestions. If you have proposals and things that you think that we can do, beyond just saying, let's just keep what we have, because that just flat out may not be an option because of the costs involved. But if you can think of ways that we can both save money and keep your benefits as high as we possibly can, then we certainly look for your assistance. I mean, you're a bunch of smart people out there, too, and we don't have all the answers. We recognize that. So give us a hand, attend the meetings, make proposals, and let's see where we go. Vice Mayor.
I agree it's a difficult situation. It is a balancing act. But I think one of the answers may be what we have done, in effect, maybe not quite correctly, or quite as we should do it. In my opinion, we did make a commitment to people when they came in. I don't see why we can't honor those commitments and still reduce the cost in the long run by the next people that are coming in have a different plan than the people that we already made that commitment to, so that down the line it comes out. And if you look at the numbers, we're not talking about a lot of people that are retired and so forth. So I would like that looked at very carefully. Thank you.
Certainly, I think we all agree with that, Vice Mayor. Member Behringer.
Thank you, and thank you for the presentation, and thank you for taking the time. There's a 73 show. I don't know how many public meetings we have where 70-plus people show up at. So, number one, I think that that's a good start to an engaging dialogue that is on the right course as far as engagement of those who would most impact. So, it's good. We can work on timing. As far as, I'm in agreement with Member Johnson as far as the amount of individuals that we're talking about. And at the end of it, what I believe it comes down to is we take a national issue, right, and it's homegrown. So the national issue is healthcare is a mess. Nobody walks out of the doctor going, that was cheap, right? And it's either the insurance agent, somebody's paying for it, it's never cheap, and to include prescriptions and so on and so on. So then at the end of this, I just look at it as, in my opinion, one of the benefits of working for Titusville was you won't get paid a lot, but on the back end, the benefits will be there, your retirement will be there, stick it out. Now we're doing 40-plus years. In the private sector, non-existent. Doesn't exist. So I can't use the same metrics as the private sector. I don't. Or I can, but I don't. It's not the same thing. In the private sector, if I get 4 to 7 years out of somebody, we're lucky, right? With 4 good careers. So being said, it's a different deal. And if the problem is healthcare costs are what's really the problem, it's not the retirees. They're doing what they earned, right? They're saying, hey, you said it, can we earn it? And they earned it while they protected us with their with a life's work. Then at the end of the day, can we protect them from having to shell out additional funding when the ability to earn at retirement age isn't quite there anymore? You know, and that's what I look at. So at the end of it, are we going to shield those who shielded us and put in a lifetime's career of work and absorb the cost? And as a citizenry, do we accept that as a citizenry, as a city, to say, yes, that's worth it? And I don't know anybody who would. And you look at, I don't want I want new officers because we need new officers. But I also look at new officers or new employees that would be watching this right now to go, are you going to meet your commitment? Because after 40 years, after 20 years, after 27 years, what's it really going to look like? And I think that right now, in addition to the healthcare cost concern that we have, is that we also have a retention challenge that I would say that we have to take a look at right now. We have to figure out how to, from staffing and so forth and so on. And right now, one of the best things I agree with right now is that the recommendation that this is not a tomorrow decision, 2018, take a look at it, because these folks have had doctors for a long time. That new process of going to find, this is not, I'm 40 and my doctor's getting real important to me, right? So I put another 20 years on it and that relationship becomes critical. So those are all concerns that I have, and as far as which way to go with it, I think I'm self-explanatory on that. But thank you for getting the information and at least getting a dialogue going.
Member Pritchard.
I just thought I'd throw this out. I thought I had a complete understanding, and everybody started talking. We're not trying to take anything away. You can stay exactly where you are. What we're trying to do is just add extra packages of choices for people to make choices on, correct? That's what I thought we were working on. No? I think they have stuff already set up. My goal was when we started this, and I think it was what we talked about that time, is to get different packages together. My thought is if I was retired right now and I could go get one of the Advantage plans, I would love the city just to send me a $300 check, and I'll go get my own and take care of it so I can travel where I want to. So I just wanted everybody to have different choices, and their way it would save the city some money on it also. So I'm hoping by the time we get done with all of this, it'll put more choices into your hand, maybe save the taxpayers some money, and who knows, maybe the whole landscape in the next few months will change completely in the country as far as healthcare. I have no idea, but I believe we're going to get through this. I think the new hires, though, coming up, we have a whole nother concept moving forward with that of different retirement plans, correct? Mr. Yeah.
Well, the value of the subsidy or stipend upon retirement is different.
Right, because nowadays out in the market, there just isn't these types of plans. So we're still looking at old plans grandfathered in that you guys moved in with that we have to work through and hopefully maybe give you some options down the road to where you're benefited and it's all taken care of. But that's the goal.
One more piece of information.
Ms. Mosley, you had your 3 minutes, I'm sorry. Unless council has a question for you.
Yes, Ms. Mosley, can you come to the podium for a second? And I wanted to say, I'm really surprised you're over 42 years old to be able to retire. Thank you.
Could you pull the microphone back up, please?
The city's been good to me, but I do want to point out, when you talk about this is older plans and whatever, I want to make sure that the city council knows, there's a lady sitting right there, that 20 months ago was offered by the city to retire early and was guaranteed health care. Now, these prices didn't escalate in 20 months, so what's the deal? Once again, 2008, I was promised health care. The $500 cap, we retirees found out about it in a letter. We did not have any information prior to it happening. We did ask that question. The answer was, no, it was negotiated. The response from the audience was, who'd you negotiate with? Well, the unions. Unions don't represent retirees, so that's not really valid. But I just want to make sure that we have an honest, clear dialogue. So there wasn't any cap on mine. There wasn't anything else. I get it. Costs are escalating. But you promised. 20 months ago, you promised it again. It's not like this is something old. You promised it in 1994 to this person and that one back there that said, save us money, retire early, you can have your insurance at no cost for life. So I guess what I'd say is, a promise is a promise. Isn't that what you teach your children? You know, because you want them to be honest, ethical people with integrity. I guess I'm asking you, are you honest, ethical people with integrity? It's happening again, you know, so where are we at with this? That's all I'm asking, is get the full story and then mean what you say what you mean. That's it. I think that's all. Is that what we're asking? That's all we're asking. That's all we're asking.
We hear you, Ms.
Thank you.
Mosley.
Thank you. Was that the last card, City Clerk? Okay, council have any other questions?
Sorry. I do, sir.
Member Berenger?
When is there a scheduled follow-up meeting slated, dated, and announced?
We don't have one now. Our plan is to look in the month, I know we get back together in the month of July. We have 2 meetings in the month of July. Between now and then, we hope to meet with our retirees, kind of take these concepts and define them a little bit more, because they had some questions, and I think some real good questions about, the option and what you can purchase for this option and what does it mean to me. We talked about the employee health center clinic concept, and we're working with our clinic so that possibly the Medicare eligible folks can use that as a primary care physician. There's some good concepts that we have to work out a little bit. So I think a good plan might be that if we could target maybe the month of July, one of the meetings, come back after we've met with the retirees and continue this process on. We've got some time to do that.
And that would, so just whatever the fair amount of time would be for, and I'm sure
Right.
that will, as moving forward, that we can figure out what, as all parties feel fair. It's a challenge getting notification out to folks, to everybody who's engaged in that. That's the only thing I would say, is just whatever would be considered a fair amount of time, and that's considering during the summer as well. So,
Right.
thank you.
And Mr. De Niro, you have contact information for all our retirees?
Yes, we do,
So that you
sir.
can keep them informed of when
Yes.
meetings will be occurring?
Yes.
Okay, and for any of you out there, if you do not get a message, you might assume that the city does not have up-to-date contact information for you, and you might want to double-check to make sure the city does have up-to-date contact information, so that we hit both sides of the equation. Okay, the chair will entertain a motion to acknowledge the presentation by staff. Moved by Member Pritchett. Do I have a second by Member Berenger? All in favor? Yes, opposed, motion carries without objection. Moving on to boards and commissions, we have to fill one alternate member on the Historic Preservation Board. City Manager?
Currently, there's one vacancy for an alternate member with an unexpired term to expire on 31 October 2017. There's currently one application